A 68-year-old man with a history of end-stage renal disease presents to the emergency department with chest pain and shortness of breath. He is diagnosed with a pulmonary embolism. Which of the following is the most appropriate initial anticoagulant therapy for this patient? A. Low molecular weight heparin. B. Unfractionated heparin initially, followed by warfarin. C. Warfarin only. D. Fondaparinux. E. Dabigatran. Before going forward, please pause and write your answer in the comments. Now let's find out the correct answer. For patients with end-stage renal disease presenting with a pulmonary embolism, unfractionated heparin is the preferred initial anticoagulant therapy due to its safety profile in renal impairment. Once the patient is stabilized, transitioning to warfarin for long-term anticoagulation is appropriate. The correct answer is B. Unfractionated heparin initially, followed by warfarin. Why not low molecular weight heparin? Accumulation in renal impairment. Low molecular weight heparin is primarily excreted by the kidneys. In patients with ESRD, low molecular weight heparin can accumulate, leading to an increased risk of bleeding. Therefore, it is not recommended for use in patients with significant renal impairment. Why unfractionated heparin? Short half-life and monitoring. Unfractionated heparin has a shorter half-life and its anticoagulant effect can be rapidly reversed by discontinuing the drug or administering protamine sulfate. Unfractionated heparin is not primarily cleared by the kidneys, making it safer for patients with renal impairment. Additionally, unfractionated heparin's effect can be closely monitored using the activated partial thromboplastin time, APTT, allowing for precise dose adjustments. Why warfarin is safe in renal patients? Metabolism. Warfarin is metabolized by the liver and does not depend on renal function for clearance. This makes it a suitable option for long-term anticoagulation in patients with ESRD. Warfarin therapy requires careful monitoring of the international normalized ratio, INR, to ensure therapeutic effectiveness and to minimize the risk of bleeding. By starting with unfractionated heparin and transitioning to warfarin, healthcare providers can effectively manage anticoagulation in patients with ESRD while minimizing the risk of complications associated with renal impairment. If you loved this video, please like and hit the subscribe button. We will keep uploading new questions on a regular basis.